Hi, I'm Dave Turpin, the Interim Editor-in-Chief of the AJODO. I'd like to welcome you to the journal and our Case of the Month. In this short video, I will show selected pre-treatment records of a case report that was accepted for publication in this month's issue. After you review the author's treatment options, I want to know, how would you manage the treatment of this patient? Upon initial examination, this Japanese girl was 5 years, 10 months of age. She was referred for orthodontic evaluation with a chief complaint of severe crossbite combined with an anterior open bite. She had been diagnosed previously with Beckwith-Wiedemann syndrome, or BWS. This syndrome is often characterized by macroglossia and a Class III malocclusion. She had a long mandibular body length, a steep mandibular plane angle, and an obtuse gonial angle. The etiology of a severe Class III malocclusion with open bite was related to hyperplasia of the tongue, a phenotype associated with this syndrome. Under normal circumstances, with this degree of dental and skeletal severity, the only treatment option might have been to wait until all growth ceased, then initiate orthognathic surgery combined with comprehensive orthodontic care. But for this team of specialists, an early phase of orthopedic change was desired. So in their first phase of treatment, they considered vertical chin cup application at the age of 6 years for a lengthy period of time. In addition to this early start, both mandibular first permanent molars were to be extracted to aid in the long-term control of open bite. This period of time was followed by drift as all permanent teeth erupted. A second phase of treatment was initiated at the age of 20 years, 10 months of age. This treatment included a full edgewise appliance, surgically assisted rapid palatal expansion, a quad helix appliance, and later on a third phase of treatment. This consisted of a LeFort I osteotomy, bilateral sagittal split, ramus osteotomy, and a genioplasty at 26 years, 9 months of age. This final phase of active treatment took 8 years, 4 months, and the stability of this outcome was monitored with full records for another 6 years. What do you think of the 30-year management of this patient's treatment? Allow me to give you a sneak preview of the patient following appliance removal. From superimposed tracings of the pre- and post-treatment head films, a hyperdivergent pattern of growth was evident throughout the patient's treatment with vertical headgear. It's obvious the lengthy 2-phase period of treatment was successful beyond all imagination. The overall stability may place value on early recognition of the damaging effect of untreated macroglossia. A logical treatment approach for the correction of these effects, including the macroglossia, is performing a glossectomy before problems in speech and development occur, but not before the age of 6 months. 2 to 3 years of age is a more common time for the glossectomy. The authors of this case report look back over 30 years of experience in managing this patient's needs with a final comment, and I quote, "Balancing the structure and function of the dentoalveolar and musculoskeletal tissues of the orofacial complex in this is key to a good treatment outcome with long-term stability in patients with the Beckwith-Wiedemann syndrome." To find out more about how the authors diagnosed and treated this patient, click on the link below to view the AJODO May Case of the Month on our journal website.